Assalamualaikum warahmatullahi wabarakatuh. Uh, Today actually is the last day of Ramadan, and for to Hijrah. Tomorrow, all Muslims around the world will celebrate its Eidul Fitri. It has been a long time since I posted a video. Okay. I think the last posting was late November 2020. So I want to apologize for that. Okay. Today I want to resume my sharing of knowledge regarding surgery to all my doctors, especially house officers and junior doctors. Okay, what topics I'm going to share with you? Very short, maybe 10 minutes only. Okay. The topic today is, what are you supposed to know and prepare when you assisting the operations? I specifically put on houseman assisting appendicectomy, open appendicectomy. Okay. First and foremost, your duty is started not in operation theatre. The moment case posted for appendicectomy is the duty of the doctors, the team. Usually the team comprises of house officers, MOs, and rarely surgeons are involved. So it's a good practice that you must see your patient in the ward before patient going to OT. So you must know when the case put up for surgery, doesn't matter whether it is appendicectomy or carbuncle, saucerization, laparotomy. Take the opportunity to visit the patient in the ward, know a little bit about the history and the fundamental aspect of the patient, like investigation, blood, group and cross match, CT scan film, all the HP reports before you enter the OT. Okay, so the duty of the houseman is to see the patients before patient going to OT, and you have to practice safe surgery saves life. Means make sure all the particulars of the patient are right. The site of the operation are right. The right patient to be operated. So patient going for appendicectomy, see whether the consent is taken properly, whether the patient is underage, and whether the witness is documented there or not. Okay, these are the things. Assess the patient, then you go to the OT. You go to the operation theatre. After you change to the OT attire, provided you have been briefed by the OT sister before, wear appropriately, and it is advised that you come earlier than MO, earlier than surgeon, because this is a good practice. Don't come after the medical officer already scrub, we just then you reach the OT in rushing, and everybody is already scrubbing and going to operate. It's not nice. You have to come earlier than medical officers. Okay, then you have to follow the SSL procedure by identifying a patient, see the documentation is right patient or not. Write in the board, on the board there you have to write all the particulars of the patient, the operating surgeon, the nurses, the time of surgeries. Okay, then prophylactic antibiotics. So prepare the prophylactic antibiotics for the appendix, usually Zinacef and Flagyl, Zinacef and Flagyl, or Zinacef only, and you give double strength 1.5 grams, and then you give these antibiotics but ask permission from the anesthetist. Don't just give to the anesthetist and let the anesthetist keep the antibiotics and give it late, because the objective of prophylactic antibiotic is the antibiotics concentration should reach the inoculation area at the time of surgery. Alright, so maximum dose of antibiotic double strength you should give, but you ask the permission from the GA, said I want to give the antibiotics. Normally they will allow you to give. Okay, then you scrub. I assume you know how to scrub. Scrub it properly. Choose your right gloves, double gloves, wear the appropriate attire, and then during PKP, during COVID-19 pandemic, make sure you wear protective face cover and mask, okay, at least. Okay, and then you join the operations. Sometimes if you are senior house officer and they allow you to paint the area using Providon or chlorhexidine, and then always keep your hands above the waist, and then always listen to the instructions. Okay, you are assisting the appendicectomy, so you must know a little bit about the operations. It's good that you communicate with the doctors. It's good that you communicate with the doctors. It's good that you read something before you enter. So at least the anatomical part. So usually there are 9 layers that you need to go through before you reach the appendix. So what are the 9 layers? Skin. Alright. We use lance incision, skin. And then there are 2 layers of subcutaneous tissue, scarpas and campus. Membranous and fatty layers, so 3. Then you will see the white glistening area of aponeurosis, of external oblique aponeurosis. It goes like this. Okay, it goes like this. So external oblique aponeurosis, and then once you divide it obliquely, and then hold with R3, the MOs will hold with R3, then you will see the brown fibers of external oblique muscles. So you can see external oblique aponeurosis and external oblique muscles. Then transversus abdominis, which goes transversely. Then internal oblique muscle. So you have skin, 2 layers of subcutaneous tissue, external oblique aponeurosis, external oblique muscle, transversus abdominis, and internal oblique. So already 7. Then you will reach the transversalis fascia, the number 8, and the last one is peritoneum. So 9 layers. So 9 layers you have to remember. Upon reach, so at this time, you need to hold the retractor, helping the medical officer to have a good visualization on the inner structures. So what are the structures that we cut? Indeed, we only cut the skin, subcutaneous tissue, and external oblique aponeurosis. The rest we only put a scissor, straight scissors, and retract. Okay, until you reach the peritoneum, then you cut another layers. So not many layers you cut. Okay, once you reach the peritoneum, how to identify the appendix? Appendix is actually appendages of the cecum, or other people can even mention it as diverticula of the cecums. So it actually is a convergence of 3 layers of tinea coli, 3 layers of longitudinal muscle. Okay, 3 layers of longitudinal muscle and converge at the bottom of the cecum and form the tubular structures. So if you don't see the appendix, trace this longitudinal muscle using instrument called Babcock. Okay, using Babcock, lift like that, and then always replace with another Babcock, and Babcock go inferiorly until you reach the bottom of the cecum, and you find the appendix. Appendix can be inflamed, perforated, or normal. Okay, and once you reach the appendix, the MOs, medical officer, will hold the appendix stump, appendix tissue with Babcocks. And there are, if this is appendix, like that, Okay, if this is appendix, so there are meso-appendix coming down like that, and there are appendicular artery. So the medical officer will dissect this appendicular artery, clamp and ligate it. Okay, ligate with absorbable suture. Absorbable suture can be monosine, can be novosine, can be Vicryl. Okay, and then the medical officer will undermine the base of the appendix, clean the area, and then clamp it with straight forceps. Okay, clamp it with straight forceps, and then move it proximally about 1 centimeter and clamp it another times. The first clamp with ratchet to create like serrated area, so that when you apply the suture it holds there. Or you don't have to do that, just if you ligate it below the artery using again absorbable suture. Okay, and you can use even bromide catgut. And some, if the base is a bit friable, the MO will do stitch tie, but actually it's enough for you to make 360 degrees tie around the base of the appendix and ligate it, and then cut it below the straight forceps, and then the raw area of the appendicular stump is cauterized, so that the dead tissue, the tissue, glandular tissue of this appendix are dead. Because take out the appendix, and then clean, inspect the area, suck whenever there is pus or whatever. Before that, you should do that. In case of doing in the female patients, take the opportunity to look into the ovary and see a fallopian tube or not, and then make a habit of tracing the distal part of the ileum at least, if possible, 2 feet to look for Meckel's diverticulum. This is important if you find the appendix is normal. You have to look for other causes of right iliac fossa pain. Okay, once clear, use swab stick to clean everything. Alright, use swab stick to clean everything, and then close the layers, 9 layers that I mentioned just now. So how to close? Close the peritoneum with absorbable suture continuously, and then approximate all the muscles that you retract, the transversalis, facial, internal oblique, and external oblique. You don't suture it, but you have to close the external oblique aponeurosis with absorbable suture. Interrupted the suture for subcutaneous tissue, and then up to you to close the skin by means of non-absorbable interrupted like Teflon, or you can use subcuticular technique using absorbable suture. That's it. Okay, that is the very basic procedures. So whatever I mentioned to you just now, you should write it in your operation note, exactly what I mentioned from beginning till the end. Okay, in summary, like lance incision, all the layers I mentioned, 9 layers just now being explored, cut, external oblique being cut obliquely, retract all the muscles I mentioned, cut the peritoneum, identify the appendix by tracing the longitudinal muscle, appendix clamp, cut and ligated with absorbable suture. So appendix clamp, cut and ligated. Mesoappendix with artery actually should be written first, then only appendix cut and ligated. All the area inspected, the base of the appendix, pelvic swab sticks, terminal ileum being traced, no Meckel's, ovarian being inspected, normal, and then close in layers. Last kali, you give the local marking to the skin and subcutaneous tissue. That's it. Okay, post-operatively, what is the plan? Usually, post-operatively must include analgesics. Usually, this patient will be discharged the next day unless they need to continue antibiotic in case of operated appendix for 4 to 5 days. Otherwise, they will discharge the next day. So, antibiotics prophylaxis single dose, and analgesic the next day they can take orally. If you want to discharge patient the next day, some even if the anesthetist give subcut morphine, that is only for 1 day. Okay, because most of the average time for appendicectomy is less than 1 hour. If simple appendix done by senior surgeon, maybe 30 minutes to 40 minutes. Okay, thank you very much. I hope you get something from that. Selamat Hari Raya. Follow SOP. Inshallah, we will be we can go through this pandemic seasons, inshallah, by the end. I hope everyone being vaccinated, and selamat Hari Raya. Assalamualaikum.